All right, good afternoon, everybody. Today we're releasing a new report that takes a look at how crisis care is functioning across suburban Cook County. It reflects what we heard directly from residents, mental health providers, and social service organizations. What's working, where the gaps are, and what we must do to build a stronger, more equitable system. Let me begin by thanking Dr. Kiran Joshi, Chief Operating Officer of the Cook County Department of Public Health, and Avik Das, Executive Director of the Justice Advisory Council, for leading this critical work. I also want to acknowledge our community partners, Grand Prairie Services, Thrive Counseling, Pillars Community Health, NAMI Metro Chicago, and NAMI Chicago. You're on the front lines every day, answering calls, showing up for people in crisis, and offering care and dignity when it's needed most. We are grateful for your service. This report provides a clear picture of where we stand and where we need to go. It underscores what we've long known. Mental health and substance abuse issues touch every community and many families. For too long, the primary crisis service available to our residents was 911. Police officers were tasked with the responsibility of managing mental health crises without specialized training or education. In July of 2022, 988 was launched nationwide. Our report indicates the important progress that's been made in building awareness of these new community-based resources. 30% of residents in crisis indicated using 988. However, too many people in crisis still turn to 911 or overcrowded emergency rooms because they don't know about 988 or cannot connect to timely support. Barriers like cost, transportation, and long wait times persist. These challenges fall disproportionately on the south and west suburbs, communities that have endured decades of disinvestment and limited access to behavioral health services. Cook County is committed to changing that. We currently fund the majority of community-based mental health organizations that support the 988 crisis line and provide crisis care to our residents within Cook County. This investment is over $15 million and reflects our commitment to support the state's implementation efforts. We're working with community health workers, trusted local partners, to raise awareness of 988. We're advocating for suburban resources and investing in strategies that reduce barriers to care. And we're helping build a model where behavioral health professionals, not law enforcement, lead the response to behavioral health crises. This report makes one thing crystal clear. When we listen to our communities and work across agencies and systems, progress is possible. But it also makes clear that we have a lot of work ahead of us. Investing in mental health is essential to building safe, healthy, and thriving communities, and Cook County will continue to move forward with that commitment at the center of our work. Now, I'd like to call on our commissioners who are with us, beginning with Commissioner Lowry, and I would ask that each commissioner introduce the person who follows. Thank you.
Thank you.
Thank you, President Preckwinkle. I am Bill Lowry. I serve as Cook County Commissioner of the 3rd District. I also serve as Chair of the Health and Hospitals Committee for the Cook County Board of Commissioners, and I serve as Vice Chair of the Cook County Health Board of Directors. The release of community and provider voices, strengths and opportunities in the suburban Cook County crisis care system, prepared by the Cook County Department of Public Health and the Justice Advisory Council, represents a critical moment in understanding the realities facing our behavioral health landscape. This report is not simply a collection of interviews or survey data. It is a mirror. It is a reflection of what our communities are experiencing and what our behavioral health providers encounter every day on the front lines. Higher caseloads, longer waits, increasing need. Nearly 1 in 5 adults experiences a mental health condition each year, and our suburban regions reflect similar trends. Local data reinforces that behavioral health organizations are navigating an unprecedented demand with limited staffing, constrained reimbursement structures, and inequitable resource distribution, across the state. This report helps us understand not only the pressure points within our system, but also the human impact. Families searching for help after hours, teens struggling with anxiety and depression without timely support, and healthcare providers working beyond capacity to address the urgent needs of us all. Accessibility is needed, and the 988 hotline answers the call. But while 988 has made crisis services more accessible, now more than ever, the findings in this report demonstrate that awareness remains an opportunity, as the research shows that crisis hotlines can reduce emotional distress, foster ongoing care, and in fact, save lives. 988 is the suicide and crisis lifeline. As policymakers, community advocates, and system leaders, our responsibility is to transform this data into meaningful action. We must strengthen provider capacity, enhance cross-agency communication, and the awareness of 988 so that every resident knows that help is only 3 digits away. 988, 988, 988. Thank you. It is now my pleasure to bring up Commissioner Tara Stamps.
Good afternoon. I'm Cook County Commissioner Tara Stamps of the 1st District. Thank you, President Preckwinkle, and thank you to our partners at Cook County Department of Public Health and the Justice Advisory Council for bringing us here together today. And thank you to every community member, provider, and advocate whose voice helped shape this report. Your honesty, your courage, and your lived experience are the heartbeat behind today's conversation. What we are lifting up today is more than a document. It is a mirror reflecting the strengths, the struggles, and the truths shared by residents across suburban Cook County about our crisis response system. When people tell us where the system is working and where it is falling short, our responsibility is to listen and then to act. One of the most urgent findings in this report centers on the awareness and the access to the 988 Suicide and Crisis Lifeline. A lifeline can only save lives when people know it exists and when they can reach it without fear or barriers. And right now, too many of our residents, especially in communities that have historically been underserved, are still unaware or unsure of how to navigate crisis services. We also heard that while there are many committed providers doing extraordinary work every day, there are still gaps in coordination, equity, and resources. But I want to be clear. These findings aren't failures. They are opportunities to strengthen what's working, opportunities to close the gaps, and opportunities to build a crisis response system that truly meets people where they are. As a commissioner and as someone deeply rooted in community and profoundly concerned and invested in mental health, I am committed to ensuring that Cook County continues investing in a system that is culturally competent, trauma-informed, equitable, and accessible to every resident regardless of zip code. This means strengthening coordination, expanding youth-focused supports, and making sure every individual and family knows that 988 is here for them 24 hours a day, 7 days a week. I want to thank every person who lent their voice to this process. Your stories, your insight, and your truths are guiding our next steps, and they remind us of something powerful. When government listens to community, and when we work together with honesty and intention, we move closer to a Cook County where crisis care is not a privilege, but a promise. Thank you. And coming now, I will bring forward Commissioner Bridget Degnan.
Thank you, everybody. My name is Bridget Degnan, and I'm the Cook County Commissioner for the 12th District, which covers parts of Chicago's north and northwest side. I'm thrilled to be here to amplify the important findings of this Community Voices report. I also want to thank the Cook County Department of Public Health, CCH, our County Board President, and the Justice Advisory Council for their dedicated work making our crisis response system stronger and more collaborative. Reports like this allow providers and governmental bodies to look in the mirror and reflect and ask what is working and what could be done better. We've made progress in Illinois and Cook County across our crisis care centers with 988 mobile response units and $18 million of investments into community-based organizations that support the 988 crisis line, including NAMI Chicago and NAMI Metro Suburban. But this report makes clear there is still work to do to break down existing provider silos, increase knowledge of available services, build community trust of law enforcement and health providers, promote culturally competent care, and address significant burnout in our healthcare staff. Our number one job as public servants is to keep our residents safe. The report survey noted that more than 75% of the individuals who access the crisis care system had to use it more than once, with 28% needing crisis services more than 5 times. This speaks to the need for coordinated, culturally competent, and immediately responsive care. At a time when our federal government is creating trauma and terrorizing populations of people who may feel lost in their own home, this report is critically important. The federal government is making cuts to health care. We need to double down on supporting and protecting our communities. This means holding the line and expanding healthcare services, promoting awareness of what is available and where, and then better coordination across all these sectors. We may be under attack by our own president, but the county and the state can and we will continue to fight back through our work and our budgets. I want to thank JAC again and the Cook County Department of Public Health for producing this report, for bringing us here today, and for shining a further light on the need to examine what is working, what could work better, and how we can all move forward together. And next, I'd like to introduce Commissioner Frank Aguilar.
Thank you, Commissioner Frank Aguilar, 16th District. You know, timing is everything. They say timing is money, but timing can probably determine whether you're alive or dead. So I'd like to commend, my President Tony Preckwinkle and my colleagues and other partners to put this together, because it does. Again, timing is of the essence. So thank you very much. Next person is. Commissioner McCaskill.
Good afternoon. I am Dr. Keisha E. McCaskill, your 5th District Cook County Commissioner. I want to commend our President, Tony Preckwinkle, the board, and all of the partners, especially Avik Das. Our ability to listen to our communities and have their input is imperative to the work that we do. We don't serve without you. Your input is valuable. I cannot stress that enough. We want your input. We need your input for reports such as this. One thing that I can say about this process, they identified, they evaluated, and they executed. And I appreciate that, because so many of our communities get lost in the process of creating reports. We continue to kick the can down the road until the report doesn't exist anymore, or we need to start it over. This group of individuals that is here today, I commend you on the work that you've done to do it in a timely manner, especially as we enter into the holiday season, when we know that depression and other mental health issues begin to persist. So as we move into this new jurisdiction with the 988, we want to continue to make sure we're also pushing 211, those 3 digits as well. Our ability to get information out to our communities is the way that we serve. That is our fiduciary responsibility to you. So when you elect, you're electing a body of people that are not only going to express what you need, but move the needle to make sure you get it. Thank you. And now I would like to bring Commissioner Kevin Morrison.
Thank you, Dr. McCaskill. Hello, everyone. Good afternoon. I'm Cook County Commissioner Kevin Morrison, representing the 15th District, which covers the northwest suburbs. I want to thank President Preckwinkle, the Department of Public Health, and the Justice Advisory Council for inviting me here today to speak on this report. I also want to thank all of our community partners in our fight to expand service to all. Mental and behavioral health has been one of the top concerns that I've heard from residents in my community since prior to joining this board in 2018. Families across the northwest suburbs have told me for years how hard it is to access mental health care in Cook County. Today's report gives us a clearer picture of what must come next to address this. It highlights the need for stronger coordination across our crisis response system, greater awareness of the 988 Suicide and Crisis Hotline, and improved access so every resident has someone to call, someone to respond, and somewhere safe to go during a mental health emergency. I'm incredibly proud of what the county has done since I became a commissioner to address these specific goals. We have made great strides since establishing the county's first ever behavioral and mental health department. This report is evidence of not only the resources we have devoted to addressing these needs, but also a commitment to sustaining these solutions long term. I want to thank you all again, and I just want to say, I would not be standing before you had I not had access to therapy when I experienced trauma. I give credit to all my therapists, but also the fact that I did not have to wait 6 months to get an appointment, which is just absurd that in the richest nation in the world, that there could be such long wait times. We need to do better. Our federal government should not be making healthcare more expensive for our residents most at need. We need to do everything within our collective selves to be able to push forward in a direction where everyone can access not just healthcare, but mental and behavioral healthcare as well. And I put a reminder out there for everyone. Seeking therapy, seeking mental and behavioral health services is a strength and never a weakness. I want to thank you all again and thank everyone who contributed to this report and everyone for working every day to support our residents in need. I look forward to continuing this work together as we build a more compassionate healthcare system for all of Cook County. I know Commissioner Trevor is not speaking today, but I do want to recognize that Commissioner Maggie Trevor is with us. And with that, I would like to welcome up Commissioner Alma Anaya.
Thank you, Commissioner Morrison. Hi, everyone. Alma Anaya, Cook County Commissioner of the 7th District. I also have the honor of serving as the Vice Chair of Health and Hospitals Committee, which is one of my greatest honors, specifically because of the wonderful work that a lot of folks here in the room are doing. I want to take a quick pause and just thank everybody who has been a part of this process. We had a behavioral health summit. We heard from many people a few years ago. We continued the work. We invested not only $40 million in the Stronger Together grant, but additional for the 988. We do continued investments, and I'm extremely proud of everybody here today. We have, Board of Director Chairman Raul Garza here. We have, a lot of our departments of public health individuals. We have Cook County Health and a lot of the commissioners that have continuously said this is important. We need to invest in this. And when we had the opportunity, we made sure to step up, and of course, under the great leadership of Madam President and her team. So I just want to commend them and thank them for their visionary work, because yes, we could do reports and we can continue to make resolutions and move that forward, but it needs to be tied to funding. It needs to be tied to change in resources and protocols, real investment, and real outreach. And I believe that this is what it's really guiding us to do. I think this is in a great time to being able, it is very timely. Not only is it budget season, but we're gonna be hearing from a resolution regarding behavioral health in our committee. And again, it's just to look at the different resources, the different stakeholders, because everybody plays an important part. And it's great to see that, the Justice Advisory Council has partnered up with Health and Hospitals on this report, because we know a lot of these things are connected. And you can't just address one without making sure that we're addressing multiple pieces of the situation. So I am very proud to join, all of the commissioners here and Madam President and all of the stakeholders in saying that we're committed to this and we're hoping to continue to move that needle forward, like Commissioner McCaskill said. So thank you. And now I'll introduce Cook County Board Chair Raul Garza.
Thank you, Commissioner Anaya. Get rid of some of this paper. So today marks an important step for the entire county of Cook. I'm not going to repeat a lot of what's been said already. That's the challenge when you're the 10th speaker. But what I will say is that the report does bring out and brings forward the lived experience, as Madam President noted, of residents, providers, and advocates. And it shows how overwhelming and fragmented the path of care can be when someone is in a behavioral health crisis. I'm grateful to President Preckwinkle and our Cook County Board of Commissioners, our world-class Cook County health staff, and also our community partners. Their work and their voices will ensure that what we do going forward will guide our work. Here's what stood out for me when I went through the report. What stands out is uncertainty. Families often don't know who to call or what to expect when they make that call. Trust and clarity matter, especially when people are already under stress. And when the system feels disjointed, families wait longer, they often disengage faster, and they put off seeking help only when the situation becomes at its worst point, and that's when it's a crisis. In public health, we have the responsibility to both deliver high-quality care while driving down costs. As the chair of the Cook County Health Board, I want to emphasize this, and I believe this as the chair of the board, but I believe it in my day job as well. Integrated primary and behavioral health care matters, and crisis prevention starts long before someone reaches that breaking point. You know, I had a vision 25 years ago where I saw the kids we were treating who were mostly Medicaid or uninsured, didn't have the same opportunities as kids with commercial insurance who had access to world-class health systems. Why not give them the same experience that those kids have, which is an integrated care experience? So as a matter of the report, it's a call for action, but it's also a roadmap for us. What I'm confident, like very strongly confident, is that Cook County Health will use the insights to, one, deepen partnerships, two, strengthen the continuity of care that exists in the county, and then finally, build a connected system that helps prevent emergencies before they begin. Thank you.
I think Dr. Makaitis?
Yes, the leader of the world-class health system, Dr. Eric Makaitis.
You're supposed to have cue cards, but I didn't have it.
Okay, well, good afternoon, everybody.
Good afternoon.
Thank you, Chair Garza, for your continued support. I also want to thank President Preckwinkle for her unwavering leadership and advocacy for our health system, as well as the entire County Board of Commissioners. And in addition, the CCH Board of Directors, including Chair Garza, Commissioner Lowry, Dr. Maya Green, and Gina Masuda Barnett, who were able to join us here today. Thanks as well to Dr. Joshi and Dr. Nutter and our teams who work on advancing access to behavioral health each and every day. And as well, thank you to our colleagues for their partnership at the Justice Advisory Council. I also want to thank and recognize the partners who've joined us in this work. These are the organizations who are working in their neighborhoods, responding to crises, and serving individuals in their journey to well-being. Grand Prairie Services, Pillars Community Health, NAMI Chicago, NAMI Metro Suburban, and Thrive Counseling Center. Thank you all for your partnership. At Cook County Health, our team sees every day the critical role crisis care plays in someone's ability to thrive, not just in the moment, but in the days, weeks, and months that follow. Over the past few years, we've seen meaningful investments across the state and right here in Cook County to transform crisis care from 988 to mobile crisis teams and culturally humble, person-centered behavioral health services. The infrastructure is growing stronger, and that is something to celebrate. This report tells us that while people are using crisis services, too many are still turning to emergency departments or 911 instead of 988. That represents both a challenge and a tremendous opportunity to strengthen awareness, build trust, and promote the care model that meets people where they are. It seems similar to how hospitals have been working to help people seek the right level of care at the right time. A patient might go to the emergency department for a mild cold or a prescription refill. They'll wait for hours. It's expensive, and ultimately that's not the right place to receive that type of care. We need to connect them with preventative, primary, or urgent care, not an emergency department. As we continue to work to turn this trend around, we're often trying to change care-seeking habits that have been established over generations. The same is true for behavioral health care services. We're up against long-standing patterns, persistent and detrimental stigma around mental health conditions, and a system that hasn't always made the right care the easiest choice. But with 988 and community-based crisis care, we're building a new muscle memory, and that's a journey we're on together. Cook County Health and our Department of Public Health are not doing this work alone. We're partnering with and funding community organizations who are the trusted hands and hearts delivering culturally responsive crisis care right in the neighborhoods that need it most. We're deeply committed to supporting them, reinforcing their work, and ensuring they have the resources to thrive. Today is not just about identifying gaps, but about elevating solutions and committing to shared action. I'm proud of the work Cook County is doing collectively, and the health system is committed to continue working alongside our partners, advocates, and providers to build a truly equitable behavioral health care system for every person in Cook County. Thank you again, and it is now my pleasure to welcome to the podium Dr. Kiran Joshi, Chief Operating Officer for Cook County Department of Public Health.
Thank you so much, Dr. Makaitis. So first, I'd just like to say, wow, what an amazing group of people we have gathered here today, from Madam President, commissioners, our partners, and of course, our mighty team at the Cook County Department of Public Health. And at the risk of being self-indulgent here, I want to take a moment to acknowledge Hannah Kite, the director of our Community Behavioral Health Unit, Candace Gunby, and Monica Chen, all of whom played a crucial role in the development of this report, along, of course, with our partners at the Justice Advisory Council. Together, we're taking really important steps toward building a crisis system that truly reflects the needs and voices of our residents. We know that there has been tremendous progress towards improving our behavioral health systems and the crisis care system across our country and in suburban Cook County. This report represents an opportunity to highlight that steady progress. So I want to share some high-level key findings. One, we uncovered that there is very clearly a lack of equitable access to crisis care services and deep disparities in behavioral health outcomes across our region. Some of the communities in suburban Cook County have nearly 6 times the rate of emergency room visits for mental health needs compared to others. We know that these differences are not random. They reflect the ongoing impacts of structural racism and the uneven distribution of health resources across suburban Cook County. Residents also told us that they face barriers such as cost, insurance concerns, long wait times, and lack of transportation. We're well aware that there needs to be better coordination between schools and hospitals and providers, and the process for accessing care are very complex and inconsistent. We must create smooth transitions of care and no wrong door entry points. We heard as well that there's distrust between law enforcement and communities of color. This necessitates clear distinctions between mobile crisis teams and law enforcement and reinforces the imperative to provide robust, trauma-informed, and equitable crisis care by trained behavioral health professionals. We need greater awareness of 988 and the crisis care system. A third of our survey respondents reported having called 988, and I would argue this is a tremendous accomplishment 3 years after launch. But we also know there's an opportunity to increase awareness with the community using outreach through trusted community organizations and institutions. And that is why we're planning to invest in digital marketing and working with community health worker networks to raise awareness about 988 and help residents understand where to go for help. At CCDPH, we are committed to doing our part. We're working with our partners to reduce barriers to care and strengthen the linkages between 911 and the crisis care system. People need continued support. They need connection, and they need stability. The commitment to this work, which I think is evidenced by the tremendous group of people standing here before you, is why I am so proud to work for Cook County. And in lockstep with colleagues from Cook County's Office of Behavioral Health, colleagues from Cook County government, including the Justice Advisory Council. Together, we can create a crisis system that is equitable, coordinated, and rooted rooted in compassion so that everyone in Cook County can access the help that they need when they need it most. Thank you. I'm now pleased to turn it over to my friend and colleague, Avik Das, Executive Director of the Cook County Justice Advisory Council.
Good afternoon.
Good afternoon.
Hey. I'm Avik Das, proud to be the Executive Director of the Cook County Justice Advisory Council. It's a wonderful, generous acknowledgments of the Justice Advisory Council we've been treated to today, and I hope to reflect that back. Thank you to the commissioners. Thank you to the leadership, Dr. Makaitis, Dr. Joshi of Cook County Health, Cook County Department of Public Health. As I speak to my remarks, I just want to acknowledge it's about centering the person and not the crime. That's what brings us to this table, that we show up for the whole person. And I'm so grateful that I've had a partnership with Cook County Health, Cook County Department of Public Health, about talking about no wrong door for individuals to receive what they need so that all our communities can be safe and thriving. And so with that, I want to say, why is an agency like the Justice Advisory Council focused on criminal justice reform, community safety, part of this conversation? Because we absolutely need to be. Health and safety are fundamentally interconnected. To improve one, we must address both. To provide effective support to someone in crisis or someone vulnerable to being lost to violence, we must take a holistic approach that actively addresses all their needs, from behavioral health to housing, employment, legal aid, and on and on. Our holistic approach must be coordinated. For far too long, we have operated in silos. Government agencies, healthcare providers, community organizations have carried out amazing work, doing their work. They have formed partnerships, but not yet built the behavioral health ecosystem necessary to serve our communities at the level to which we all aspire. Even with hard work and best intentions, working in isolation will not bring about sustainable change. But that is why we are here today. This report is a very, very inspiring turning point. The outreach and engagement reflected in the report are crucial steps towards building the behavioral health ecosystem that we all need. We now have a roadmap that is affirmed by residents and workforce members that support those experiencing crisis and navigating next steps. This report contains a wealth of information that a wide bench of partners will use to support the health and safety of Cook County residents, and we are proud to be a part of this bench. Our amazing health experts at Cook County Health and the Cook County Department of Public Health will work with community-based service providers who are the experts in providing culturally competent care at the neighborhood level. The Justice Advisory Council, or JAC, will help ensure our behavioral health ecosystem is built equitably. We will focus investments where they are needed most. We will prioritize non-police crisis response models that are proving to be effective, compassionate alternatives. We will work to counter the historical wrong of criminalizing mental health crisis, an issue that disproportionately impacts communities of color. We cannot continue to have Cook County Jail serve as the only mental health care provider that many residents can access. We are committed to working together to build Cook County's health and safety ecosystem so that people in need have access to a continuum of care that not only supports them in the moment, but as they move forward and heal. Together, we can increase access and awareness to prevention, crisis care, and the ongoing community-based behavioral health services that work. We want to lift them up. Thank you for your time. We need to hear from how this work is being done from some amazing partners. So it's my honor to introduce Sharon Ward, President and CEO of Grand Prairie Services, a community-based healthcare provider anchored in Cook County's south suburbs. Thank you.
Good afternoon.
Good afternoon.
I'd like to thank you, everyone, President Preckwinkle, for allowing me to come up and talk about the services that we provide in the South Suburban area. As I listened to the speakers that came before me, what really struck me was the fact that when I was younger, I did my dissertation on criminal justice system, mental illness in the criminal justice system. That was years ago. You know, you can actually tell. But that was years ago. And I didn't know at this time in history that I would be here really defending and advocating for those folks who are, and especially what's talked about, those who are in the criminal justice system instead of receiving the services they actually need, and those services that can be provided in the community. I represent the South Suburban area of Cook County. I live there, and I've lived there for 38 years. I've worked there for probably more years than that. And I have to say that although we think that the services are available, readily available to everyone, that is a desert for the services that are needed for the folks who live in that community. For the parents who have children who need mental health services, there are few psychiatric services that are available for them by persons who are double board certified in child and adolescent psychiatry. So having the right services at the right time, in the right place, the right amount of services is important. And I like to thank Cook County for that. I've gotten reports and on committees, and thank you very much, from Cook County Department of Mental Health, Behavioral Health Department, as well as Cook County, again, social services. But I do want to say thank you and everybody in this room for all the hard work that you're doing to make sure that the people that we live with, the people that you and I live with, our relatives and our friends, and especially the people that I've been serving for over 38 years, will have the right to access to services that they readily need. There is a shortage of behavioral health services in the Southland community as well as throughout the country. As you look at the number of psychiatrists that are available, they're very few. And as you look at now, we have nurse practitioners, still very few. But who are the people that don't have access to the services when they need them? These are the people that we serve in the Southland community of Cook County and are in need of these services, and we don't have the sources to be able to provide those. And so I would like to say thank you. I would also like to read one thing, and we're going to talk about, and Tim is going to talk more about CESA. And I am.
We'll do the CESA. I'll talk about it. You're the pro on CESA.
We're a tag team. We've been together probably about 30 years. Yeah. But I like to thank the state of Illinois and Cook County for all the resources that we have available to us. And one of the things that was really important when I first took my job was that the development of the CESA legislation after the fact that we were responding to crises in the community, weren't really prepared for them all of the time. Police officers had no idea of how to respond to crisis in the community. But then there is CESA. And I have to say, this is the beginning. It is not the end. We're not there yet, so be patient with us. But this is the beginning of being able to provide mental health services to those who are in the community, no matter where they are, no matter what kind of episode they may be having, no matter how much money and no matter what color they are or nationality, they still have the access to crisis services. And that's through CESA legislation. And I wanted to also talk about the fact that we, as a South Suburban area, we're divided into townships, and we're on the committee, and Ms. Gumby is also on our regional advisory committee as well. But on a committee, we have a group of folks, police officers, fire chiefs, everybody of all the different disciplines, first responders, hospitals, execs. And we come together on a monthly meeting for a meeting about an hour and a half, where we actually sit and we discuss how to respond to crises in our community. And not just how to respond, but how to provide services that they need so that they no longer have this rotation of back and forth into the hospital. I'm just going to talk in plain English, right? Going back, the repeat revolving door into the hospitals that someone already talked about that says that it's overloaded. There's not enough space for the folks. It is not the intention was not for a regular hospital in the community to provide crisis services on a continuum basis. But CESA legislation has allowed us to resolve some of those problems. And at least it allowed us to take a look at those problems or those issues that we're facing throughout the country. But in particular, I'm talking about the Southland area of Cook County,